Hey guys, so in today's video, I thought that I would share a description of what functional neurological disorder is. And if you guys didn't know, when I was at the inpatient rehab unit, um, or on the inpatient rehab unit, back in October of 2024, I was diagnosed with functional neurological disorder as well as having the paralysis and things like that. So that is why this topic is important for me to share with you guys, because I feel like there's not enough awareness of what functional neurological disorder, or FND, is. And so, like I said, in this video, I wanted to explain to you guys what it is. So if you see me looking down, I do have my phone down here because I did write some notes because I wanted to make sure that I didn't miss any information in this video. So let's get started. So what is FND, or functional neurological disorder? So FND is a medical condition where a person experiences neurological symptoms such as weakness, tremors, seizures, or problems with movement, speech, or sensation that are not caused by structural damage to the brain or the nervous system. So some people have non-epileptic seizures. Some people have different types of episodes. It just kind of depends on the person. Some people have tics, like verbal tics or motor tics. It just kind of depends. A lot of people, it tends to look like a stroke. And so, like, they can have facial drooping and things like that. Again, it's going to depend on the person. Instead of having the structural damage to the brain or nervous system, the brain has trouble sending and receiving signals properly. So it's basically how they described it to me at the inpatient rehab unit is it's like a software problem instead of a hardware problem. So the nervous system is structurally there and fine, but it's not functioning the way it should because those signals are not being relayed properly. So some common symptoms of FND are limb weakness or paralysis. My limb weakness and paralysis was not caused by FND. It may have played a little bit of a part in it, but mine was caused by other things, as I've talked about in previous videos. It can also cause tremors or jerky movements, non-epileptic seizures, also called functional seizures. Gait or balance issues. Gait is just how you're walking. So it could look very different. It could be shaky. It could be off balance, things like that. Again, balance issues. Speech or vision problems. Some people have the vocal tics, where it's almost similar to Tourette's. Some people have speech issues where they might sound like they're slurring their words. It might sound like they're drunk. They might have issues finding the correct word, things like that. And that's kind of where people start to think that it's similar to a person having a stroke. Vision problems, it could be blurry. It could be all kinds of different things. And then again, numbness or tingling. So those are things to look out for. So here are some facts about FND. FND is real and disabling. The symptoms are real. They're not imagined. It's not somebody who is trying to make up symptoms to get attention, things like that. They can be as severe as those caused by other neurological conditions or disorders. There is no structural damage though. So standard tests like MRIs and EEGs often come back normal, which can be confusing and frustrating for patients. It is also misunderstood. So FND, it used to be believed that FND was purely a psychological condition, and recent research has shown that it is not. Modern research shows it's a complex interaction between the brain, the body, and the mind. And it's also treatable. Many people improve with the right treatment, which may include physical therapy or neurophysical therapy, psychological therapies such as CBT, and education about the disorder. So one thing that they told me when I was in inpatient rehab is one thing that really helps with people's outlook or people's prognosis is accepting the condition. So what causes FND? There's no single cause. FND can be triggered by trauma, physical injury or illness, emotional stress, other neurological conditions, or sometimes it just happens without a clear cause. So it's just going to depend on the person, again, like I said. So basically, FND is a disorder of function, not structure. Again, it's real, it's treatable, and awareness for this condition is growing. Early diagnosis and understanding of this condition are key to recovery. I think one of the most important things is that getting out that awareness, because I don't feel like enough people know about functional neurological disorder or FND. A lot of people just think that, again, people are faking symptoms to get attention, things like that, and that is not the case. FND can be very disabling. Very disabling. It just kind of depends on if the person gets the correct treatment, if they are treated correctly, if the medical provider knows what FND is. That definitely helps. I don't feel like there's enough education for our medical professionals about FND, and I think that there definitely needs to be more. I'm a part of some groups where they're trying in the UK to get more awareness out, and they have petitions and everything like that to get more education for medical professionals. And I think that we definitely need that here in America as well. So, anyways, hopefully this helped explain to you what functional neurological disorder or FND is. If you guys have any questions about my experiences with FND or about anything in general, please leave them in the comments below. If you have any comments or suggestions on topics you would like to hear me talk about on my channel in the future, let me know that as well. And I will talk to you guys in tomorrow's video.